what are the kind of things that can explain the chronic cough?
There are two things that we want to exclude from the ENT perspective, which can give rise to a cough. One is a chronic postnasal drip, and the second one is acid reflux. Acid reflux can lead to, again, basically what it does is acid reflux can cause the cough, and acid reflux can also exacerbate cough, because particularly at night when you lie down flat and the acid comes up to the back of the throat, it can lead to some degree of postnasal drip or increase in nasal secretions, and that leads to then coughing, and that can have an effect. But once that is excluded and that is not the cause, and everything else is completely normal, which is very common, and the patient is still coughing, then it becomes a very difficult dilemma to treat. And one thing I've come across is that these individuals will have what is called a hypersensitive respiratory tract. And these patients who have a hypersensitive respiratory tract, when you ask them one question, before all of this started, did you have a rather aggressive or a long-lasting cold? Majority of the patients will say, yes, it was a head cold which brought on my coughing.
And it never got better. The cough.
The cough, yeah. And it's again the change in the mechanism of the neural hypersensitivity or hyposensitivity, which leads to the coughing. And that's why it's known as the hypersensitive respiratory tract syndrome, where the patient coughs. The good news is that this cough usually settles in time. The bad news is how long will it take to settle, and we don't have an answer. Some will settle within a few months, some will take a year or two. But the commonest thing that I advise my patients to do, so a cough which is because of a chest problem, you can't hold that cough back. It has to come out because you're blowing out phlegm or whatever. But a cough which is secondary to a hypersensitive respiratory tract, this cough, when you can actually, if you want to hold it for suppress it for a few seconds, you can. And for these patients, I tell them to walk around with a bottle of ice cold water with crushed ice. And every time they have a desire, they want to cough, I tell them, look, the moment you're about to cough, if you can hold your cough for a few seconds, take a sip of ice cold water with crushed ice. And what it does is it breaks the cough reflex. And if you keep on doing it over and over again, it breaks that mechanism of neural hypersensitivity, and it allows a significant improvement in the coughing.